When we're looking for transverse plane rotation postural distortions on postural examination, truly the best perspective view would be if we could get up on a ladder and look down to see the rotations. But short of doing that, our next best alternative is an anterior view as we have here. So let's start from the top and work our way down. First thing we would look to see is if the client's head, neck are rotated a bit to one side. Okay, back to neutral posture. Perfect. Now we look for their trunk, thoracolumbar spine. Maybe she's rotated to the right, but we see the pelvis is still oriented anteriorly. Back to neutral posture. Or perhaps the pelvis is rotated to the right, but we see that the trunk is still faced forward. Back to neutral. Looking at the upper extremity, if she has upper cross syndrome and she has medially, internally rotated arms at the shoulder joints, or perhaps just on one side, we would see that by looking at the arm as well as the posture of the hand here, because it would be faced more inward instead of forward here. Okay. Next, if we work our way down, looking at postural distortions for the position of the hip joint. If the femur is medially internally rotated, we would know that two ways. One way is we look at the kneecap, the patella. The patella always sits on the femur and it follows the posture of the femur. So if one patella is oriented toward the midline, then that means the femur is oriented that way. And certainly we will normally see the foot turned inward as well. Back to a neutral anatomic posture. And now at the tarsal subtalar joint region, the ankle area. If she has excessive hyperpronation, then normally she will collapse on the inside arch and the foot will flare out laterally. That flaring out is technically called AB, abduction of the foot at the subtalar joint, but it can be looked at as like a lateral rotation. And that abduction lateral rotation is a component motion of pronation. And when we see that, if we see that the kneecap is still facing forward, then we know that the foot is not flaring outward because of an excessive lateral external rotation of the thigh at the hip joint. We know that it must be occurring down at the subtalar region. Okay, back to a neutral, healthy posture. One other thing to look at, when there's a postural distortion of the spine or the pelvis and spine, very often what we will see is the hands will sit relative to the trunk in a slightly different posture. One hand might be closer, the other might be farther away. That's another telltale sign to look for when we're looking at rotational postural distortion patterns.